Hi, John Hoffman, Senate District 36. You know, this week I've been lasered in on education bills and really discussing what's important for education in our state. I'm going to talk about two of them. First one is we had a hearing in the Education Policy Division on food nutrition, specifically the free and reduced lunches. My part of that was the reduced lunches and finding funding that would pay for the kids that are currently on reduced lunches, because what we found is that even those children can't afford the 42 cents that it would cost to provide lunch. So at a nominal fee, the state can step up and assure that all the children in free and reduced are eating their lunch, and it's free. Why that is important is because research shows when a child is fed and they're studying, they have better outcomes regarding testing. Their ability to stay present with the teaching moment is there. We heard from testifiers like Cindy Hiltz, who's a school nurse. She's in charge of the largest school district's nursing programs and sat on or sits on the National Board of School Nurses and was the past president of Minnesota School Nurses. So we heard the medical side. We also heard the nutritional side of it. And we heard that from various folks that work within the nutrition area in school districts. And the presentation also came from some youth that go to schools in Hopkins and Talmud Torah, came in and gave a great discussion on why this reduced side is good for us. The second thing I want to talk about is last week mentioned about the mental health bills. Well, you know, we heard those in hearing today, and they passed out. And what's really important to that is the one I worked specifically hard on is the school services, the services for kids within schools in the mental health world, and getting school districts to partner with nonprofits or with private organizations to help fund for the mental health services that are needed within schools. That helps a couple of things. And it's really germane to education because of the fact you got kids, 50% of the kids that were on mental health programs last year needed IEPs. And so when services are being extended to children through age 22, having this coverage up to age 26 is really going to be important. The other thing that it helps is it breaks down barriers. It breaks down the barriers of transportation and families having to leave their work to come get their kid from school. Because you know, when your child isn't in school, they're not receiving a free public education. And after all, our state constitution says what? It's got to be fair and uniform, that every child gets a free public education. So I'm excited about those two, and I'm excited it's lasering in and doing the hard work, and we're still here and we're still doing that hard work. So thank you. Talk to you next week.